Hi, everyone, and thanks for joining us. I'm Maggie Pokella, Senior Manager of Global Market Development here at the Genetic Testing Solutions Business Unit in Thermo Fisher Scientific. And I'm joined today by Dr. Manoj Gandhi, who's our Senior Medical Director. Today, I'm going to be having a conversation with Dr. Gandhi about what we might expect when COVID-19 meets the flu season. Hi, Dr. Gandhi. Thank you so much for joining me.
Thanks for having me, Maggie. It's a pleasure to be here and having this discussion with you on a rather important topic.
Let's dive right in. So with SARS-CoV-2 infections still spreading around the globe, it's quite apparent that we're going to soon be at a point where the flu season is going to overlap with the COVID-19 pandemic. So can you share a little bit about what we already know about co-infections with SARS-CoV-2 and other respiratory illnesses?
Yeah, first, let's talk about COVID-19. COVID-19 is quite a new virus, and we as humans do not have any immunity to this novel virus. As we have seen in the past 6 months, more and more of the population is getting infected with the virus. If one has to learn from other viral infections, there is a very good possibility that this virus could become endemic. In comparison, influenza has been around for about 100 years. However, in the early years of the evolution of the influenza virus also was very lethal. While today influenza is still lethal, the mortality rate has dropped because we as humans have acquired a level of immunity to this virus. And now the influenza virus is a seasonal virus, and it is in these winter months that influenza cases peak in the northern hemisphere. The problem that we have here is that this influenza season will occur while the world is still dealing with the COVID-19 pandemic. Now, coming to your question as to co-infections, it is more likely that the patient will either have one or the other rather than both infections at once. There is limited data out there to say if co-infections can or cannot occur. There is a very distinct possibility that the patient who is infected with COVID can be infected at the same time with influenza or vice versa. When one looks at the studies that have been conducted, the most common viruses that are associated with COVID-19 happen to be RSV, influenza A, influenza B, and other rhinoviruses. However, the most likely situation would be that the patient who presents to the hospital has either one or the other, and the odds of being co-infected are rather small. Another realistic possibility is that the patient gets infected with one virus, then recovers from the illness, and after some time falls sick with another virus. However, if a patient does get co-infected with influenza, for example, while we don't really know what the exact course of the disease would look like, it is certainly expected to be much worse than if it would be one at a time.
That's really interesting. So with all of that in mind, what are your thoughts on how this might impact patient management moving forward into the flu season?
One of the issues that our medical community has been concerned with the flu season overlapping with the pandemic is the whole issue of patient overload. Until last year, when COVID was not around, hospitals used to gear up for the flu season, and then things would quieten down after the season is over. However, with the pandemic, the healthcare systems, especially the emergency departments and the intensive care units in places that have really been hard hit by the COVID-19, are already stretched to the limit, and now they have to deal with the flu. While no one really knows what the true impact will be, this is one of the biggest concerns of the medical community, which is the whole issue of patient overload.
Okay, so with patient overload in mind and trying to understand what this twindemic might be bringing us, how exactly would somebody clinically distinguish between these different respiratory infections, and what role is testing play in here?
If you look at these different respiratory pathogens, the problem with them is that they all present with rather similar symptoms, such as fever, cough, body ache, and runny nose, among others. There are some subtle differences, such as loss of taste or smell and shortness of breath that is seen generally in COVID patients. However, that might not be the case in all patients, and for the most part, the symptoms between COVID and the flu are strikingly similar. So the issue really becomes is how can the physician really distinguish one versus the other? It is very difficult to distinguish based on just signs and symptoms, and one really needs to perform a test to distinguish between these diseases.
Right, that makes sense. So Speaking of tests, I'd like to get your thought on where test makers, especially us here at Thermo Fisher Scientific, fit in. Can you share any of our upcoming plans for moving into flu season?
Yeah, it is really up to companies like Thermo Fisher Scientific to make the test to serve the needs of the physician and, more importantly, the patients. We already have a test that has received emergency use authorization for the detection of COVID-19. However, with the flu season approaching, what we are doing here at Thermo Fisher Scientific is to make a test that can distinguish COVID from flu A and flu B in a single test, so that with a single test, the physician is able to distinguish these diseases and make the right decision for the patient. This test is a PCR-based test that with a single nasopharyngeal swab is able to tell the treating physician whether the patient has COVID-19 or the flu. And if it is the flu, which one is it? Is it flu A or flu B?
Really exciting. I'm looking forward to learning more about that soon. So let's also talk a little bit about therapies for flu and therapies for COVID-19, because I know we've made progress there. Where do these new therapies or existing flu therapies fit in?
So like I said before, whether it is COVID or flu A or flu B, these patients really present with rather strikingly similar symptoms. And most of these treatments for these patients are mainly symptomatic. So one really can ask the question, why does it matter to distinguish whether these symptoms, if they are the same, why does it really matter to distinguish between one versus the other? While it is true that the mainstay of managing these patients is mainly symptomatic, there are some significant differences in the treatment of COVID patients and flu patients. What we have learned in COVID-19, for example, there is an acute phase of the disease where there is the release of what we call cytokine storm, and this can have a negative effect on the lungs. This causes shortness of breath that we see in these patients, and we refer to that as an acute respiratory distress syndrome. This acute respiratory distress syndrome can actually be treated with steroids and interleukin-6 inhibitors such as tocilizumab, in addition to giving these patients respiratory support such as a ventilator. However, when you look at influenza, we generally do not see these cases where the patients have a cytokine storm and present with ARDS. Hence, there is no really need to suppress the immune system. In fact, in patients with influenza, steroids are actually contraindicated and are known to actually make the disease worse by suppressing the immune system and making these patients more susceptible to secondary bacterial infection. Similarly, there are very specific antiviral treatments that have been approved for the treatment of COVID-19 versus influenza. For example, there is remdesivir that has been approved for the treatment of COVID-19, whereas it has not been tested in patients with influenza. Similarly, antivirals such as oseltamivir and zanamivir have been approved for the treatment of influenza and have not been approved for the treatment of COVID-19. Also, it is very important to know if a patient has COVID-19 versus the flu, because the prognosis is slightly different. Flu patients generally have a better prognosis as opposed to COVID-19, and knowing this is also very important. Another factor that you would want to know whether it is COVID-19 or the flu is the decision around quarantining these patients. If a patient is COVID-19 positive, strict quarantining measures need to be followed to stop the spread. With influenza, while it is important not to have the influenza spread, one really does not need to follow such strict quarantining procedures that are very similar to what we see in COVID. So whether it is through a patient perspective or through a public health perspective, it is really, really important to know why it is important to distinguish. And it is really through testing can one really differentiate between these diseases. And that's why it is very important to distinguish between the three.
So there's been a lot of recent news around COVID-19 vaccines, which I do know are still at least a couple of months out or more. But there is a flu vaccine available and always has been available for a while. So what role is the flu vaccination potentially going to play in combating the so-called twindemic?
The flu vaccine is available yearly, and this year more than any, one should certainly get the flu vaccine if it is available. In some parts of the world, the flu vaccine is not easily available and is expensive. But here in the United States, the flu vaccines are generally widely available, and one should certainly take it. As for whether flu vaccine will help in combating against the COVID, it will play an indirect role in actually combating against the flu in this twindemic. What is known about the flu vaccines is that they are certainly effective against the flu. And even if one does get the flu after vaccination, the symptoms are less severe than if one did not take the vaccine. As far as coming to your question, whether there is a direct effect of flu vaccination on COVID, I don't think there is enough data to show one way or the other that there is the effect of the flu vaccination on COVID. And that is the reason why pharmaceutical companies are striving hard to develop the COVID vaccine. The two viruses are actually quite different. Influenza virus belongs to the Orthomyxoviridae family, whereas COVID-19 belongs to the coronavirus family. And there are differences between the structures of these two viruses, that each of these viruses require its own specific vaccine. Hopefully in the future, there will be a vaccine against COVID-19, and it will become part of the flu vaccine, so that with one vaccine, there can be protection against both COVID as well as the flu.
That's really interesting and kind of exciting to hear about. I know we're all anxiously awaiting a potential COVID vaccine. So I've also read some neat articles about acquired immunity, and I have to admit, I don't know much about this topic. So I was hoping you could explain a little bit more about what acquired immunity is, and more about it in the context of COVID versus the flu.
Now, this is a very interesting topic, and much remains to be known. The way I see it is COVID is a very new virus, and we as humans have never been exposed to this virus before. So there is no herd immunity against COVID. With flu, it has been around for 100 years, and we as a species have evolved with it and learned to live with it. With each passing year, our body gets used to this new strain of flu virus, and either through natural infection or through an immunization, we get used to it. Similarly, we have to learn to live with COVID too. COVID, just like other viruses, will also mutate. And whether it is through natural infection or when we get a vaccine, our body will mount an immune response to this virus. Our immune system will know how to deal with it. And as a result, the virus would not be as virulent as it was when we first saw it for the first time. This is the whole concept of acquired immunity. However, having said that, we are at a very early stage in the process, and this journey with COVID has just begun.
Good. So we're coming to the end of our time together, and I just wanted to kind of have a last opportunity for you to share any additional thoughts that you might have about the implications of SARS-CoV-2 reemergence during flu season and any complications we might see from the overlap.
The one thing, if I had to say and look at COVID, and there is not much, there's not much brightness to see, there's not much silver linings in this, but if I had to really say there's one bright spot, that is that people are generally more aware towards healthy habits. If people had to follow social distancing practices, wearing masks and PPE, and the greater emphasis on flu vaccinations, it may actually help decrease the incidence of flu this season, and it may be even actually milder than years before. In fact, there have actually been some preliminary data that has come out from places like Japan and Taiwan, and actually countries in the southern hemisphere that just went through the flu season, that the flu season was actually milder than years before. So we certainly hope that that is the case, but only time will tell, and we will see how this all works out.
Thanks so much for your time today, Dr. Gandhi. I know I really appreciate it. I learned a lot, and I'm looking forward to learning more about Thermo Fisher's new solution when it comes out. Thanks everybody to joining us today, and we are so happy to have you.
Thank you so much. My pleasure. Take care.